Hello, hello. I hope you're well. Thank you so much for joining me. My name is Mbali Soke, and I am an enjoyer of all things mental health related. I'm not sure if that sounds right, but I really love all stuff that has to do with mental health. Today, we're going to be going through another article, but before we dive into that, please don't forget that the article link is going to be in the description below. Let's get into the article. So the one that I picked today, new study highlights how to improve mental health integration in South African primary healthcare. Okay, and this is a recent one as well. It's from the 7th of July 2025, and it is by Wits University. A staggering 92% of South Africans living in with mental health conditions are not receiving the treatments they need. Well, I didn't know 92%, just knew that. A lot of people that actually need help are not getting the help that they need, especially in treatment. Yet, research continues to show that collaborative care, where mental health and primary care providers work together, can significantly improve patient outcomes. Yes, service satisfaction and overall quality of life. People with serious mental illness, SMI, okay, so anytime we say SMIs now, we're speaking about serious mental illness, are particularly vulnerable as SMI is associated with marked functional impairment and high levels of stigma. Oh, yes. I think that's just the really. So, in the last video, we spoke about mental health, healthcare facilities, and dealing with people that are struggling with their mental health or mental illness in a rural area. Speaking about stigma, especially with people with serious mental illness, like the badder it is, the higher the stigma, the sadder the situation, because that person is also a whole lot more vulnerable. SMIs typically include psychotic disorders, bipolar and related disorders, major depression, and severe anxiety and stress related disorders. A new study published at Cambridge Prism's Global Mental Health explores how integrating community psychiatric services with primary health care PHC, primary healthcare care, clinics provides access for individuals with SMI in South Africa. However, the study also reveals persistent challenges related to limited resources, weak management systems, and fragmented collaboration between healthcare providers as key setbacks. Yeah, I keep referring back to this 5% that we are getting from the health budget that is going into the mental health care. And it will also go into adding on to the limited resources. As much as we want the healthcare facilities to offer a whole lot more, but limited resources, if that's their challenge, makes it difficult for them to do their job. In the last video as well, we also spoke about how even the healthcare providers, like the nurses and doctors and whatever at these facilities, overworked and understaffed. And it makes it difficult for them to also do their work to the best of their ability. They literally just do as much as they can. It can cause a major problem because the community is generally larger than the amount of what's going on in a clinic or what's in a hospital. Oh, weak management systems as well. Fragmented collaboration between healthcare providers. Okay, so those are the major setbacks. Conducted in the Citibank district, the research forms part of a broader study series focused on patients' experiences. It is modeled on global evidence to assess the impact of community based collaborative care, a model increasingly adopted worldwide to strengthen mental health delivery in PHC settings, public healthcare settings. Okay. Why integrated mental health care? That's the headline for the next part. Ne? This might take a few days to get through. Also known as integrated care, This healthcare model plays a vital role in improving access to mental health services by bringing care closer to communities. Okay, that yes, if that's the idea, that would be wonderful. Communities are struggling. Rural communities are struggling. It relies on bringing together public healthcare providers such as physicians, nurses, and mental health providers to deliver coordinated person centered care. Is this thing actually happening? There's a picture here written the Wits Journal of Clinical Medicine is a peer reviewed open access research scientific research journal published triannually and was established to provide a forum to showcase scientific research from the School of Clinical Medicine at Wits. Is this actually going to? Okay, I want to go back to the headline. New study highlights how to improve mental health integration in South Africa, in South African primary health care. So is this like the idea of how to improve? Because this is providing so much hope that it's stressing me out. Integrated care is believed to yield better health outcomes for individuals living with serious mental illness who often have com- comorbid physical health conditions. Abdullah, the lead researcher in the study and Wits PhD fellow based at Center of Health Policy, says the paper highlights key shortfalls in how collaborative care is implemented in this district. This includes poor communication, unclear roles with multidisciplinary teams, and the absence of case managers to coordinate care, with providers instead coordinating care in an ad hoc manner. I don't know what ad hoc is, but clearly it's not right. I can understand that part, sort of. I think this happens a lot, and it's a tough situation, man. When there's a great idea, but the problem is implementation, and implementation includes communication. It includes clear roles, understood properly amongst teams. It includes managers that also get what they're doing to coordinate care properly. And when that's not the case, then ad hoc is what happens. Ad hoc. I need to. What's ad hoc? Infrastructure and staffing challenges in integrating mental health into primary care in CDBing. I'm going to go down to key findings because I feel like that's something that I would like to touch on. Key findings. Integration does not guarantee collaboration. Okay. While all the elements of full collaboration were not achieved in either setting, the physically integrated setting provided a better opportunity for communicating among staff due to shared files, physical proximity, and good management with mental health interest and experience. However, these advantages were still hindered by poor infrastructure and inadequate resources. 2 steps forward, 12 steps back. I feel bad for mental health care professionals that are interested in the work that they're doing, that come with experience, that really want to show up, but are then hindered by poor infrastructure and inadequate resources. Like at the end of the day, they can only do what they can only do. They can only do so much. Like integration models matter. That's the next point, right? Integration models matter. The study found that physically integrated clinics, shared space, and records had better communication and collaboration between mental health and PHC providers. This is public health care providers. Co-located clinics, separate buildings, and records suffered from poor communications and siloed teams. That's a Vetsi and the English that I'm reading today. I think that makes sense because these are two different spaces. A collaboration, yeah, we're in two separate buildings, but like we keep each other's records, might be a bit difficult to get to the point where we are moving smoothly together as a team compared to when everybody is under the same building. Even relationships are built better and understanding of where we're going and what we're trying to do, the goal of all that we're doing over here is understood better, faster, clearer, and moved on to, quicker. So that makes sense. Next point, resource and infrastructure constraints. Both clinics faced inadequate space, supplies, and staff. And although the physically integrated clinic was the most under resourced, in both settings, insufficient resources were further exacerbated by high caseloads. The caseloads thing also gets to me. Like, it's the end of the day, these facilities are smaller than a whole community. And there's a lot more people in communities that require help. So, as much as there's an integration, I'm happy we started with the point, yeah, or in the key findings, what they found is that integration does not guarantee collaboration. Just because we're together doesn't mean we're going to be together. Leadership is critical for collaboration. Okay. The study highlighted the importance of management in fostering teamwork. Stronger leadership qualities were evident in the physically integrated clinic, which led to reduced staff conflict and improved communication. In contrast, the co-located clinic, which is two buildings side by side, was impacted by a poor management and a lack of managerial oversight, leading to conflict among staff members. The failure to appoint a permanent chief director in the district level has also led to a lack of strategy and frustration among clinic staff. Oh, that's not cool, man. Like, that's man trying out something new and then finding that it can get even more frustrating than the already horrible situation that you were in beforehand. Okay, next point, resistance from public healthcare doctors to manage mental health. Public healthcare physicians and doctors are often reluctant to manage stable psychiatric patients. Why did that take so long for me to read? Leading to unnecessary referrals. Public healthcare physicians and doctors are often reluctant to manage stable psychiatric patients. So you being stable ends up being a burden on doctors, unnecessary referrals. That's okay, that's weird. Unless if I don't understand it right. Some providers did not feel equipped to provide quality healthcare, and others felt that collaborating with community psychiatry staff would increase their workload. If already the collaboration that would really be helpful to the community with happening is being pushed back by the people that are supposed to be doing the collaborating for the benefits of the community. If they don't want it, makes it difficult for them to actually do then what the collaboration is meant to do for the community. They're not trying to be there. In fact, they're annoyed that you, as a patient, are coming in because you are the workload that I was upset about in the first place. I didn't want additional workload. And here you are, workload. As low and middle income countries move towards integrated mental health into PHC, this paper highlights that the type of integration approach needs to be functional at all levels to enhance the health outcomes of the most vulnerable. You know what? It started off with so much hope, and then getting to the end of this paper, then I was seeing that you kind of there are problems, guys. But that's how things are generally, in general. Where there's a little good, there's a little bad. Where there's a little improvement, there's a little setback. That happens. But otherwise, if you want to go through the whole article, because I didn't go through the whole article with you, it will be linked in the description so you can check it out for yourself. I do think it's an interesting read. And it does, I think I like this because it gives me hope to see that there is some type of research that is being done in this industry, that patients are not left to figure it out on their own, or left to be like, make enough money so that you can get the healthcare that you need. If you're not financially in that best of places, then you better be fine with suffering. So it's nice to see that there is this type of work being done. Oh, this is so hopeful. Otherwise, thank you for joining me. Please let me know what you think in the comments, and I will see you in the next one.